The cardiac surgery conducted during the COVID-19 pandemic. Coronavirus disease 2019, also known as COVID-19, has established itself as a global pandemic, affecting the economy and healthcare practices worldwide. The pandemic has affected more than 200 countries around the world, including India. And globally, it has escalated rampantly, paralyzing the healthcare services. For our Indian scenario, on March 24, 2020, the government of India ordered a nationwide lockdown, limiting the movement of the entire 1.3 billion population as a preventive measure against the COVID-19 pandemic in the country. COVID-19 has caused a deep impact on cardiac surgical practices by limiting the number of staffs that are available, the treating physicians that have been diverted into COVID-19 care, the number of intensive care units, the ICU beds, the ventilators and monitoring sites, and other resources required for an effective conduct of cardiac surgery. The impact of COVID-19 on cardiac surgery in India has also been profound. Cardiovascular diseases, as we know, are the leading cause of mortality in the world, as well as the number one cause of mortality in India itself. Though the cardiovascular diseases can be avoided for a period of time, they cannot be completely ignored as the burden of disease is massive in the society, and the complete withdrawal of surgical services is not an adequate answer. Amid the pandemic, the safeguard of critical resources has been regarded as a prime matter of concern. So, what are the problems that are faced during COVID-19? The cardiovascular patients suffering from the cardiovascular disease are unable to get the required care and are succumbing to the disease. There's a difficulty in providing services due to shortage of healthcare personnel, doctors, nurses, and paramedical staff. And the resources which are being diverted for COVID care are not available for the cardiovascular surgery. There is difficulties in traveling due to the nationwide lockdown and the other specific state lockdowns. Then there are sicker patients that are due to the delayed presentation, and there is an increase in the operative mortality and morbidity that is being seen even after the conduct of cardiac surgery in such patients. So what can be done? We have to first protect the cardiac patient. We have to protect the institution and the society, and then we have to protect the healthcare team that is providing this. From the physician's point of view, we should treat all patients as COVID-19 suspects. We should utilize comprehensive patient testing. We should use personal protective gear and equipment, and we should use precautions while handling patients. We should avoid any non-essential aerosol generating procedures, and we should have an ongoing team training that should be done. Now, how to ramp up the delivery of cardiac surgery during the COVID-19 pandemic? We should minimize the disease spread and ensure patient safety and protect healthcare personnel. Then we should collaboratively manage and prioritize the patient awaiting cardiac surgery. And we should ramp up the delivery of care in a deliberate and integrated. So we have come to a conclusion that COVID-19 has silenced the medical specialties, especially the cardiovascular surgery. It is driving the routine care into jeopardy. The critical resource preservation has to be balanced with the provision of emergency care with optimal critical care standards to the ones in dire need. The Herculean task of carrying out safe cardiac surgery seems plausible with strict adherence to protocol, and the return to a regular course from this unplanned detour seems mandatory for avoiding an avoidable crisis, that is, the cardiovascular patients being neglected.